Hey, how are you doing today? My name is Ben. I'm with the USA College of Nursing, and I'll be performing a wet to dry dressing change for you today. All I'm doing right now is verifying my hospital order and hospital policy for the procedure. Okay. And so I've gathered all of my materials here for the procedure, but before we start, I'm going to perform hand hygiene. Here. And so I'm gonna turn on the sink and adjust it to a warm setting. Okay. Alright. And so I'm gonna wet my hands and apply 3 to 5 milliliters of antiseptic bacterial soap. And I'm going to wash each surface of my hand 5 times each. And now I'm going to clean underneath my fingernails. I'm also going to ensure that they are under 1/4 of an inch. Alright. Now I'm going to thoroughly rinse my hands, making sure not to touch the sides of the sink or anything else. Alright. Now I'm going to take one paper towel and dry from the fingertips to the wrists, and then dispose of that, and then get another dry paper towel and dry from the fingertips to the wrists. Dispose of that. Lastly, I'm going to take one more paper towel and turn off the sink. And then 2 reasons for using hand hygiene with antibacterial soap would be if you visibly soiled your hands with bodily fluids, or if you come in contact with something like C. diff or MRSA. 2 reasons to use antiseptic hand rub would be if your hands are not visibly soiled, but you have come in contact with a patient, or if you have come in contact with an inanimate object. Okay. And so now I'm going to, can you state your name and medical record number for me, please?
Jaguar J. Jones, 417-6352.
Awesome. And I do see that you have an allergy to penicillin. Is there anything else that I need to know about?
No.
Awesome. Okay. And so now I'm going to reposition my trash can to a good working distance, and I'm going to perform hand hygiene again. Okay, and now I'm going to raise the patient bed and lower the side rail, and then I'm going to position the patient for comfort, and then after I've done this, I'm going to apply my clean gloves and goggles. All right. Okay. Now I am going to expose the dressing by pulling up the patient's gown and then pulling down the patient bed sheet. I'm doing this so that I have ample room to work, and also in doing this, I'm also trying to provide as much patient privacy as I can. Now I'm going to remove the dressing from pulling the tape towards the wound, and when I do get this bandage freed, I'm going to remove it away from the patient. Okay. And so, upon removing the bandage, I'm going to assess the drainage from the wound. For example, for this patient, he has a red-orange serosanguinous fluid. It's got a watery consistency with no notable odor. Now I'm going to remove the primary dressing, which would be the dry 4x4, and the 4x4s in the wound. And now as I'm removing them, I'm careful not to touch the peri-wound areas. And then upon removing the gauze from the inside, I'm going to note the size, the shape, and then also any necrotic tissue, any granulation tissue, or any slough. Now I'm going to dispose of the ABD pad, like so, with my hands down towards the trash. And now, I'm going to open my sterile dressing change tray away from my body and making sure that my arm does not cross over the sterile basin. Now I'm going to carefully remove my sterile field and place it like so. Now, everything hanging off the side of the table is now contaminated with a 1-inch contamination border along the field. And then I'm going to pour my dressing, or my gauze. And then also I'm going to check the expiration date on my saline bottle here, and I'm going to, when I do open the saline, I'm going to palm the bottle, or palm the label, and then hold the cap up, and I'm going to gently pour the water into the basin, making sure not to spill, or not to splash the sterile field, or touch the side. Okay, and now I'm going to set this to the side, making sure not to turn my back on the sterile field. Okay, and now I'm going to don my sterile gloves. Okay, so putting on the first glove, I'm going to touch the inside of the glove. And then for the second glove, I'm going to be using my gloved hand to touch the outside. Okay. Now I'm going to organize my my equipment, and like so. And now I'm going to place my 4x4 gauze into the sterile basin, making sure not to touch any of the pieces of gauze to the side. Three. Okay. All right, now with that done, we're going to move on to the intact suture line. like I said, it is intact. The wound edges are well approximated, sutured closed. I'm also going to notice any redness or drainage if there is any, which right now I'm not seeing any. And now I'm going to move on to cleaning the intact suture lines, starting from least contaminated to most contaminated. Least contaminated being the the actual suture line itself, and then the most contaminated being on the peripheral sides of the wound. Okay, and I make sure to dispose of my 4x4s above the waist. Also, I am trying to work as best as I can above the waist. Okay, and now that's ringed up. I'm also positioning the 4x4 gauze in a way that ensures that my glove will not be touching the patient's skin or anything else. Is that two? No. Okay. And this will be the last one on the side. And then now we're going to pat dry with a dry piece of gauze the intact suture line and dispose above the waist. Now we're going to move on to packing the open wound, and we're going to start with wringing out the 4x4 gauze and then fluffing them to make sure it takes up a little bit of space inside the wound area. And I'm very careful right here to make sure that I'm not touching the peripheral wound area. Looks like there needs to be one more to fill the wound. Okay. All right. There we go. Okay. And now we're going to take a dry 4x4 gauze and place it over the wound area. After that, we're going to take our sterile ABD pad and we are going to place it over the sterile 4x4 gauze. Now I'm going to remove my sterile gloves, going glove to glove and skin to skin. Like so. And now I'm going to take my tape and fasten down the edges of the ABD pad. And I'm going to measure out the tape before I actually rip it off. This is just so I don't waste any tape. piece. And there we go. Now the next step would be to add an extra piece of tape with the date, time, and initials of when I actually change the dressing, and this would be for the incoming nurse. And then after this, I'm going to reposition the patient for comfort, and then I'm going to lower the bed, raise the side rail, and then perform hand hygiene and dispose of my materials. Thank you. And actually, before I go, or actually when I would go, I would actually state the documentation points for the actual wound, well, the open wound, the intact suture line, and then patient. But starting with the open wound, the drainage, as I said earlier, was red, orangey red, serosanguinous, watery, with no odor, no noticeable odor. Likewise, the actual open wound was a moderately sized wound. It was red, and it lacked an odor, just like the fluid or the drainage. As for the intact suture line, it was intact. The wound edges were well approximated, and there was no presence of drainage or redness. And then as for the patient, there was no noted tenderness. He handled the procedure very well.